Hi, my name is Catherine Price. I'm a physical therapist. Today I'm going to talk to you about shin splints. First, I want to speak a word of life, and this is from Deuteronomy 5:12. Observe the Sabbath day by keeping it holy, as the Lord your God has commanded you. 6 days you shall labor and do all your work, but the seventh day is a Sabbath to the Lord your God. On it you shall not do any work, neither you nor your son or daughter, nor your male or female servant, nor your ox, your donkey, or any of your animals, nor any foreigner residing in your town, so that your male and female servants may rest, as you do. Remember that you were slaves in Egypt, and the Lord your God brought you out of there with a mighty hand and an outstretched arm. Therefore, the Lord your God has commanded you to observe the Sabbath day. Amen. So it is commanded and important for us to rest. And today I'm going to talk about shin splints. This is also referred to as anterior compartment syndrome. It is an overuse injury. I struggled with this injury in my late teens, early 20s, so I struggled a couple years with this. It got quite uncomfortable and painful and limited my activity and took me a long time to recover. So I want to share with you treatment strategies that you can implement and not spend as much time dealing with this injury as I did. So first of all, what is shin splints? It is usually pain that's going to be on the front. It's the anterior tibialis. You can have shin splints with the posterior tibialis, but the anterior tibialis is going to be more common, and it's common in runners. You can have both posterior and anterior, but I'm going to talk about the anterior, and that's going to be on the shin. This is the tibialis anterior. I did end up with shin splints so severe that it felt like the muscle was pulling away from the bone. You can get the muscle and the tissue inflamed such that it can compress on the nerve. The deep peroneal nerve innervates that muscle, and if you get enough inflammation and pressure in there, it can then push on that nerve and cause weakness, and that'll end up with a foot drop. And I did have that, so for a while I would run and my foot would just slap. So I let it go way too long. Once you start getting pain in the front shin, you want to address it. Pain is it is your engine light coming on saying there is something wrong here. So first, and I had no idea how to treat this or any direction of what to do. So I want to show you the things that I've learned through anatomy and physiology just to address what could possibly help. It may or may not. And again, you want to speak with your medical doctor or physical therapist to find out if these exercises are appropriate for you. So the first thing I would do if my shin was overworked, so this is an overworked muscle, I then want to release the tension in that muscle. So I go through what I call release, stretch, and strengthen to rehab the body. And the first exercise would be to roll the shins. So I'm going to roll my shin. I can get a foam roller. I'm going to just rest my shin on the roller, and I'm going to pull all the way to the top of the foot and then all the way back up to the knee, but not over the knee. Now I'm going to angle. If I'm going to work on my right shin, I'm going to angle that direction and roll here. If I want to work on my left shin, I'm going to angle to the left and roll here. Now, if your shins are tight and contracted, you'll find areas of tenderness, and you want to hold on those areas and pump your foot up and down. So you're just going to release that. And if it's hurting to go to those end ranges, just start with a small range, and you're just going to pump the foot up and down. So you're just releasing that tension, mobilizing the connective tissue over your shin. And I would spend 2 or 3 minutes on this. Now I'm rolling fast. You want to go slowly through the muscle. And so you're just going to go up. The shin is going to go from the front, the outer lower leg, and it goes, the tendon is going to come around over the top of the foot. And if there are trigger points, you may feel some pain even referred down into the very top of the foot in the attachment point. So that is going to be the release. Now, if you've progressed where you're not feeling much with the roller, the rule of thumb is to go to a more narrow, harder surface area. So I've got my peanut balls, and what I can do is I don't want to roll on bone, but I'm going to take the lacrosse ball or the peanut ball, and I'm going to place it over the muscle belly. I'm then going to put my body weight into that muscle belly of the anterior tib and roll along the shin. Again, when I find an area of tenderness, I'm going to pump my ankle up and down, and that is going to release that tension there. After I have released the tension, I then just want to sit back and stretch that anterior tib muscle. So if you're really contracted and it's really tense, this can be painful, and sometimes it's hard to get to the front of the foot all the way down. So you may be stuck with a space there because the muscle is tight, the muscle tendons, and you eventually want to work down and stretch that if possible. Now, one of the things is when you develop shin splints, it can be because the shock goes up into the shin, and I have really high arches, and I tend to think that the shock goes up into my shin because the foot doesn't absorb it. However, people with flat feet can develop shin splints as well. So as soon as I start to feel any shin pain, I will stick a soft orthotic in my shoe, and that is just to help absorb the shock so that when I am stepping, I have more cushion in the foot to absorb that shock going up the leg and into the shin. The other thing is going to be how the foot is placed, and I will go over that in just a little while. So just to recap, you want to roll the shin, release the tension in the fascia and the muscle. Start with a softer foam roller, working to a harder surface area. After you roll, you then want to stretch and get that muscle to lengthen. So you can sit back onto your heels and just stretch the muscle out that way. Now, it's an overuse injury, so it's a constant contraction of the anterior tibialis muscle that is responsible for developing the shin splints. So I then want to shut that muscle down. I want it to stay quiet. It's been worked a lot. It needs to quiet down and rest. So what I like to do is contract my antagonist muscle. So I'm going to work the calf. This is also going to work the peroneals, which are going to be antagonist to the anterior tib muscle. So I will do 30 heel raises, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So by working the antagonist, my peroneals and my calf muscle, I am then working on shutting the anterior tibialis muscle down. So as soon as I start to feel any discomfort in that shin, I want to start doing my heel raises so that I can shut that muscle off. Then after I have done an activity and I feel my shins are uncomfortable, I'll go through that series, release, stretch, then strengthen the antagonist muscle. And then you want to get the inflammation out. You can put Dixie cups filled with water in your freezer so you can have a nice ice cup, or you can grab a piece of ice out of your freezer and you're just going to do an ice massage. And I like to ice massage for, you can do it for up to 10 minutes. You can do 5 or 10 minutes ice massage, and you're just going to decrease the inflammation in that area. And that is going to help manage your shin splints. The other thing to think about is if this is developed from long distance running, a lot of folks are heel strikers. I myself was and still am somewhat a heel striker, but that means you're landing on your heel and that anterior tib is lengthening as your foot comes down, and that takes a lot of strength on that anterior tib, and it ends up overworking the muscle. So if you're landing on your heel, you are going to be overworking that anterior tibialis. So you want to have somebody help you with your running, watch your running. And when you land, you want to land more in the midfoot. So you want that foot to be underneath your body and landing more in the midfoot and not out in front on your heel. Those are some things that you can start to work on changing in order to better reverse and manage your shin splints. So I hope this was helpful to you. If you start to have any of that discomfort on the shin, these techniques and interventions have been helpful for me to nip any injury in the bud before it develops and stays to be something that is chronic. Again, consult your physical therapist or medical doctor for the appropriateness of exercises for you, and have a blessed day. Thank you.